we're continuing with this book here, The Hidden History of Health, also Nutrition and Science by me, Pete Rogers. We're on page 178, and we're talking about the history of conventional medicine. So the concise version of conventional medicine history is up until 1940, don't know shit. Okay? And that's a true statement, all right? In the 1940s to 1980s, a lot of big stuff happened. Walter Kempner came along and was curing all the chronic Western diseases with the rice diet, rice and fruit primarily. Dennis Burkitt came along, figured out abdominal pressure syndrome. Nathan Pritikin came along and figured out that all fat is bad. Roy Swank came along and figured out that if you minimize saturated fat, you get by far the best results with multiple sclerosis. Nothing's even close. He had 50-year follow-up on his patients, and they still ignore him to this day. He's an MD, PhD from Harvard. John McDougall came along and he figured out all the healthy populations ate starch-based diets, feed them 90% starch, 5% fruits, 5% veggies, and you cure almost all the Western diseases. And anybody can do that, and you don't need to monitor the patient. Kempner's diet was more restrictive, and you had to monitor the patients. Caldwell Esselstyn, came along with the low-fat vegan diet and no oil, not one drop, and he had the best results of anybody by far, like basically a 99% cure rate. And he says the 1% that wasn't cured didn't follow the diet. Extraordinarily good results. David Blankenhorn's results with arteriography showed that all fats are atherogenic and about the same, equally atherogenic. They all cause atherosclerosis. Olive oil, omega-6s, omega-3s, they're all a bad idea. And what's the point? Every single one of these guys, the great pioneers of health and nutrition, not a single one of them is in the medical textbooks. Burkitt's in the textbooks for figuring out a disease called lymphoma, but he's not in the textbooks for all his nutritional work. Okay? And especially after 1980, all the medical journals, nutrition journals are mostly bogus. I spell science here with the S with a dollar sign through it because it's just paid off corporate nonsense, most of it. Okay? And conventional medicine is based on selling drugs. You sell drugs, you sell lab tests, you sell surgeries. Match the ill to the pill, send a bill. You get a patient hooked on those pills for life, and they become a cash cow for the system. Okay, and then also the genius doctors that do something good, they all get in trouble. Dr. Kempner was fired from Duke University. Dr. McDougall was fired from the radio station. They took his Malperl insurance away from him. They tried to fire Colin Campbell. Esselstyn was blocked from running a clinic at the Cleveland Clinic until he had to take legal resources involved. Books like High Pressure Blood Solution, Richard Moore said his book was taken off all the shelves. I've heard of other health books where they just take them off the shelves if they think it's going to potentially cause a loss of money for corporations. The corporation will even pay the publisher to unpublish the book. So the publisher will get a little money, so they're happy, but the book will not get sold. Richard Moore would say that he couldn't even buy his own book because it was immediately, despite selling out initially, it was immediately then taken off publication. The destruction of science and medicine parallels the de-Christianization of the USA and the West. I've talked about that before. You need to have Christian ethics. You don't need to be a Christian, but you got to have Christian ethics, or otherwise everything just gets corrupt. You have to say there is something above money, because if you don't say there's something above money, then money will control everything, and it pretty much does. Okay, and then most people are so ignorant and stupid, they don't even understand that. If you talk to the average person, they'll go, well, my doctor said, my doctor is an expert in endocrinology. Yeah, right. They don't know anything about diabetes. I talked to a bunch of endocrinologists. I never met a single one that knows anything about insulin resistance. The famous guy, Gerald Sheldman, knows, but you talk to a regular endocrinologist, including the ones that were high level in their class, top 10%, they won't know. Okay? I one time had a endocrinologist that wanted to follow me around to learn from me, and then he freaked out. You know how to cure our diseases without drugs? Oh my God, I can't hear this. Plugged up his ears and ran away. Okay, interventional radiology, imaging-guided surgery techniques improved. But, and I was an interventional radiologist myself, imaging-guided surgery, and I liked it. You do a lot of stuff to help patients, but a lot of what you're doing is you're taking care of major disasters in older people. And that helps them. You can buy them sometimes a couple extra years of life, get them in and out of the hospital fast for a kidney stone, for all kinds of things. Gallbladder drainages, biopsies, and some fancy big procedures, TIPS, thrombolysis, stenting, all that stuff. But, I like low-fat vegan diet, you can give somebody 20 extra years of life, 30 extra years of life, cure their diseases. So, this stuff has its place, but there's nothing as powerful as a low-fat vegan diet. Any internist that knows what's going on will tell you that. Everybody who knows what's going on will tell you that. It's the most powerful thing in all of medicine. The most clinically useful thing I ever learned in my whole life in medicine is what Dr. McDougall said. People eat a starch-based diet, and usually all the chronic diseases go away. That's valuable information. I've seen a bunch of what I would call incremental improvements in medicine. For example, I do tons of biopsies. I've done thousands and thousands of biopsies. And I used to have to do lots of core biopsies with an 18-gauge needle. It has a little slot on it, takes out a specimen about the size of an inchworm. With a big core, that's called a core biopsy, you can look at the cells in their relationship to other cells. That's called histology, tissue specimen. And sometimes that matters, like for a lymphoma, the relationship of the lymphocytes, and do they form, rosettes and other shapes within the lymph node. That matters for diagnosing the type of lymphoma. On the other hand, nowadays they're so good, I hardly ever have to do core biopsies. Almost always I can get the diagnostic specimen doing fine needle aspirations. I sometimes need to do 10 passes, but I get the answer almost always, so it's better. Radiology, the quality of the imaging has progressed tremendously, but that's largely because computers have progressed tremendously. We can do more and more procedures with ultrasound guidance. We got much better CAT scans, CT angiography, MR angiography, diffusion-weighted brain imaging, all kinds of good things. And they do help in selected cases. But these are relatively uncommon, okay? Acute thrombolysis for an acute stroke. How often do you see that? Yeah, it happens, but it's uncommon. Hypertension, diabetes, obesity, coronary artery disease, all day long, the vast majority of patients, okay? All right, now we're going to go, what's the worst field in medicine? I think it's psychiatry. They basically poison the patient with their drugs are all bad, cause a chemical lobotomy, and electroshock causes an electrical lobotomy. And the other thing I've noticed is, despite me being like the world expert on brain degeneration and dementia, nobody interviews me. You don't think a neurologist, a psychiatrist, a neurosurgeon, internal medicine doctors aren't watching my videos? You bet they are. But they'll never invite me because they know I'm not good for business, and it's a business, okay? All right, Asclepius was the ancient Greek god of medicine. There were shrines to Asclepius for healing. Hippocrates, started moving things in the direction of empiricism, whereby he kept records of his patients and tried to figure out what was causing the disease and what seemed to help these diseases. Galen's Four Humors was bogus, and there was sort of a moratorium on autopsy, so he couldn't learn as much as he should have. Vesalius started doing dissections and figuring out anatomy. William Harvey figured out the heart is a pump, but not till like around 1600, okay? It took a long time to figure out something pretty basic. Finally, they got a microscope, and then they started figuring out, such a thing as bacteria, and then learning about germs and infections, okay? And then you get into all the issues with that. I'm very familiar with the whole Louis Pasteur versus Robert Koch versus some of the other ones involved in that stuff. 1700s, magic potions and leashes. 1800s, magic potions and mercury. They're kind of a joke, okay? The old joke about neurology was the book of diagnoses is 1,000-page. The book of treatments is 1 page. Give aspirin, okay? Around 1900s, Freud came along with psychoanalysis, which is just a bunch of nonsense. Freud was a total fraud. He's a phony. Alfred Adler and Carl Jung were a big improvement on Freud, but they still talk a lot of nonsense. Some of these later guys, they're going in the right direction, though. The Alfred Adler inferiority principle was good. The idea of, archetypes by Jung was good. Progress in sterilizing things like Listerine. Progress in anesthesiology is good, but anesthesiology is more dangerous than people realize. In the 1900s, you had big step-ups with antibiotics, insulin, L-Dopa, thyroid meds. Late 1900s and 2000, again, everything improved rapidly that goes with computers, like all the radiology imaging stuff dramatically improved. We talked about better stains for pathology specimens. Some of my jokes, like when I do these biopsies, is I'll prep the patient, and then I'll usually have some medical student or a resident or technologist assist me, and if they're new to work with, they'll say, where did I learn how to prep like that? In prep school, okay? It's just silliness, but Everybody's a little stressed out usually during these things. I've done thousands of them, so I'm trying to relax the patient. I'm trying to relax the techs and everybody. So I'll sometimes talk a little bit like that. I always sense the patient, and I want patients to be happy. And I do a lot to make my patients happy. My patients love me. I'm very gentle, give them tons of local anesthetic. And I've done so many of these, I can usually get specimen very quickly. And so I've had lots of patients follow me around, want me to be their doctor for other stuff. And I'm like, nope, I'm a procedure doctor. I'm not your regular clinical doctor. It's a lot of responsibility. When I used to run pain clinics, I would get so many phone calls from patients. Anyways, let's see here. Cancer research is not good. 85% of cancer research is not reproducible because the corporations fund so much of it. Evidence-based medicine, genetic medicine, precision medicine, stem cell medicine, I think that's all overhyped, especially genetic medicine, because, most diseases are not genetic. They're just because everybody in the family eats the same thing. Some entire fields of medicine are fake, like child psychiatry. Give me a break giving amphetamines to kids. That's insane. The big thing that's expanded in medicine that just keeps expanding is more and more drugs, more and more stents, implanted devices, pacemakers, vagus nerve stimulators, hypoglossal nerve stimulators, intracranial deep brain stimulators for Parkinson's, all that stuff. Anything electronic, it tends to be popular in modern medicine. Laparoscopic surgery, that was a big improvement. It's not always, that easy, but that was a big improvement I saw with abdominal surgeries like gallbladders and stuff. Coronary artery bypass graft, there's some indications for it, but it's pretty overrated. Some of the valve replacements are pretty good. There's transcatheter valve replacements. I don't know how good the longevity is going to be yet. The main cause of infections in the past was people were overcrowded, living with poor sanitation and malnutrition. So once you have good sanitation, better housing conditions for people, that's caused a dramatic drop in infections. Semmelweis, was right about washing his hands, and they basically bumped him off because he told obstetrics to wash their hands. That's a sad story of what happens to innovators in medicine. Florence Nightingale did a good job, get people some sunshine, get them some fresh air, have a clean ward, patient rooms, and they do better. Modern sanitation, we talked about that, and nutrition. Antibiotics, they were very helpful in some cases. And everybody sometimes needs an antibiotic, and thank God for them. I had an eye infection. I would have gone blind, but the antibiotic cured me pretty fast. Most disease, though, is due to high-fat animal food, processed food diets, and oils, toxins. Also, the toxins in tap water have a synergistic harmful effect. A lot of people, death by 1,000 cuts, a bunch of things are adding up to make them sick. Causes of obesity, we talked about all that. Once you go down that path of anything that's making you fat, it'll tend to make you also diabetic and increase your risk of coronary artery disease, peripheral vascular disease, cerebral vascular disease. AFib, congestive heart failure, these are low-fiber diets, so they get abdominal pressure syndrome. They have tissue ischemia, so they get more cancer. So these diseases all go together. They're somewhat, to some extent, manifestations of the same thing. Okay? We talked about the guys who are not in the books, and also docs I didn't mention, Dr. Day, Dr. Sheldman, and there's a whole bunch of other ones. Dr. E.D. Moore. Okay, and most conventional docs are trained that sunshine's bad for you, avoid the sun. But you need it for a lot more than vitamin D. You need it for sulfates. You need it for nitric oxide precursors. You need it for mitochondrial function improvement, the infrared and the red light. Okay, stress management, sleep, all that stuff's important in exercise. Having a purpose life, a goal, a special purpose. And Thomas Schaus would say that, What makes people happy and resilient is they're living their life towards achieving a good purpose, whatever that might be. It could be being a good parent, a good coach, a good teacher, a good doctor, a good nurse, whatever. But you need that driving goal to energize you. Let's see, what are some of the biggest advances I've seen in medicine? We talked about how CAT scans got much better, but CAT scan. How many people every day have an acute appendicitis? In a big Western hospital, you maybe get about three appies a week. Okay, 2 appies a week. Diverticulitis requiring imaging. Positive cases, maybe about 3 a week. So those are important diseases, but on the other hand, how many patients will walk in the door of a hospital with obesity, diabetes, hypertension, coronary artery disease? Every day, 1,000. So it's more important, those diseases. Let's see, ERCP and MRCP has gotten a lot better. ERCP techniques for stone removal have gotten better. They've got PACS systems, the archive radiology reports, picture archiving systems. They got electronic medical charts. So stuff gets lost a lot less. So that is nice. Stuff gets lost less. But it can also be a pain in the butt because stuff crashes and then you got to go to paper and it's a pain. You could always scan it into the medical chart, but it's a pain in the butt. HIV treatments improved. Same thing with hepatitis C. All these patients used to die. HIV patients would die fast. Hep C patients who would die pretty bad disease. Now a lot of them live a long time. Let's see, viral infections, the patients are living much longer. Doctors want to help. Doctors try to help, and they all go to med school wanting to help, but they are forced to go by the rules. The rules are made by the insurance companies and the drug companies. They're not made by the doctors. Categories of disease. For acute diseases, you go to the emergency room. USA is the best in the world at that, and a lot of patients with terrible situations, motor vehicle crashes and other terrible conditions, the emergency rooms will save them. I've seen a lot of people saved that I didn't think would make it through the emergency room. The ER doctors do a good job. And look at all these, CHF, COPD exacerbation. Okay, fine. A lot of bad infections, tonsillar abscess, etc. PID, orchitis, cholecystitis, etc. End-stage disease, again, USA is the best in the world, putting a patient on dialysis, doing a kidney transplant surgery, heart failure treatments, all kinds of stuff. LVADs, tips for liver failure. Okay, it's good for all of that stuff. Drugs like thyroid replacement, Parkinson's, dopamine replacement, diabetes, pancreas replacement, insulin. Okay, joint replacement, all that stuff is good. But where it falls apart is it stinks at treatment of the chronic Western diseases because they're usually dietary diseases or toxin, and it doesn't emphasize improving the diet or removing the toxin, and that's the only thing that's going to give these patients the best option of cure. And I've talked to tons of doctors. They don't know the basics. They don't know the basics in their own fields because they've never been taught. And then, somebody like me gets labeled as too unconventional, so I never get invited to speak, so they never get a chance to learn. Anyways, here's just a couple of books. Masters of Medicine by Andrew Lamb. It's a decent book. There's other medical books, but I do like him. He's an ophthalmologist, and he's a pretty bright guy. Ophtho docs are usually pretty smart, and he does tell the truth about something, but he's a little bit of a cheerleader. I think he's young. I don't know how old he is, but I'm going to bet you he's maybe about 45 to 50 years of age, which is young for doctors. He doesn't know anything about nutrition. He doesn't know anything about epidemiology. He just knows sort of surgery because he's an ophthalmology surgeon, but this is good for people who don't know anything about medicine. But if you really know a lot like I do, then it's a baby book. Okay, but it's still, I think it's a good introduction to people. Okay, his book on saving sight was a better book because he's an ophthalmology book, so he has much more advanced level insight about eye diseases than he does about other things. And there's a lot of books like these, illustrated histories, but they're kind of a joke because you're just illustrating stupidity. They didn't know what they're doing. Look at all these guys operating with no gloves on, no mask on. Okay, it's stupid. Doctor's illustrated history of medical pioneers. And, he's kind of the same thing. He means well, and he gets the basics right, but conventional doctors, they don't know anything about real disease. They don't know nutrition, epidemiology, toxicology, religion, sleep, exercise. All the things that really matter, they don't know it. So they glorify all these surgeons, they glorify these pioneers of drug development, because that's all they got, and they don't know. McDougall with the starch-based diet can cure, more than 100 other doctors, or more than 1,000 of them. Normal internists almost never cure anything. Literally, they never cure hypertension, diabetes, obesity, coronary arteries. Never. They just keep the patient on a drug all their life. It's not a cure. Okay, all right. That's going to be it for this session today. I hope you found that helpful.